Okay, for this video, we're going to do a brief run through of a glasses exam. First of all, most of the history should be filled out except for the chief complaint. Up here, whatever it may be, fill that in. Secondary complaint. HPIs down here towards the middle part here. And you can just review your histories, make sure everything is matching what's on the paperwork from what the technicians typed in. Once you get to the objective tab, autorefractors at the top, NCTs right here in the middle. If you need the last RX, you can populate it from here if they were seen here before or in this system. The technician will usually put that in for you. Check VAs, unaided and aided. Preliminaries, if you start with confrontation, hit Shift F8, it will fill in everything as normal and you can change anything that needs to be changed. Moving to the refraction, the autorefractor should be already in here when the technician puts it in. If everything's exactly the same from it, you can import the autorefractor, or you can import from the previous prescription that the patient had, which is up here, or their last prescription can be brought in as well. Once you've changed your refraction to whatever it may be, use the equal sign, then you send to final to make sure this final prescription is what you want it to be. And you can also make changes to that before you finalize the glasses RX. In the RX notes, there's a drop down to make choices of what you want on the lenses. Hit select multiple after hitting the F9 button. Hit select multiple, then you can pick out everything that you want on the prescription. Hit send, and then it'll send it to that field. Hit finalize, and it'll populate everything into the prescriptions tab. Exam, self-explanatory, fill in the blanks. If you start at OD over here and hit Shift F8, it fills in everything normal. Go to the assessment and plan, place your diagnosis in, whether you know it by the number or if you start typing, it will fill in the blanks. If you want multiple choices, start with a few letters, delete the rest, hit F9 here, and it'll show you every choice there is with those letters in it. PRES is in presbyopia, pressure, and suppression. So anything with those letters in it will show up on the list. And which eye goes over here. And then your plan. When you want them to return and what for. Go to your routing slip here. This is where your diagnosis codes will already be there because you put them on the assessment part, and you can pick the procedures that were done, whether it was comprehensive refraction with a toric contact lens. If you need to delete one, right click, hit delete. Any visual field screenings or digital retinal screenings, you can add that to the list, and then populate on this side what diagnosis goes with what codes. Once you hit close, that will automatically be ready for the technicians up front to check the patient out. That's pretty much the glasses exam in a nutshell.